So with that, it is just my distinct honor and pleasure to introduce our speaker for today, Dr. Argivan Salas. Dr. Salas is a special advisor for DEI, diversity, equity, and inclusion programs here in our Department of Medicine, as well as a senior researcher at the Clayman Institute for Gender Research. She completed her medical school here, as well as her residency in general surgery. During her residency, she earned her PhD in education, studying explicitly diversity, inclusion, and equity, and then went on to complete a fellowship in minimally invasive surgery at Washington University in St. Louis. After staying on faculty in St. Louis for a few years, she returned to Stanford in 2019 to work with our medical school on issues related to diversity and inclusion. Her research focuses broadly on gender equity, implicit bias, diversity, inclusion, and physician well-being. And she has given over 80 national and international invited talks related to gender equity and sexual harassment in medicine, which is the topic of our time today. During the pandemic, Dr. Salas has also served as a disaster relief physician caring for patients with COVID in ICUs. Her work has been published in journals such as JAMA Surgery and JAMA Network Open. Just in this past month in JAMA with a piece on anti-Black racism in healthcare, and just this past week in the Lancet on the impact of COVID on women and institutional actions to take. She also writes for broad audiences through outlets such as USA Today, Time Magazine, and Scientific American, as well as pretty much all the social media venues, Twitter, Clubhouse, you name it. And I have to say, before Dr. Salas joined our department, I had actually consulted her regarding gender equity work in palliative care, just having seen her in action in multiple outlets. So I was so thrilled to hear that this national leader in diversity, equity, and inclusion was joining our department. And she is an ally and an advocate who has shown me the importance of our voices and how to use media effectively. So please join me in welcoming Dr. Salas. Her presentation today is titled From Cuomo to Healthcare, Sexual Harassment in the Modern Era.
Well, thank you so much for that very kind introduction, Stephanie and Dr. Harmon. And it is a pleasure to be here today. And thank you so much for inviting me for this opportunity. Let me just share my slides and we'll get going. All right, so just right off the bat, what I'd love is if we could just take a few seconds and reflect on what names and cases pop into your head when you see sexual harassment. For me, for example, Cosby is a person who pops up into my head, Cuomo, obviously, but I'd love if people would write some names into the chat of either cases or specific people that come to mind, because we're going to come back to that in just a few minutes. If I can make sure that I can see them, or I might not be able to see them. But anyway, I would love to just have you think about that for like one more second. Okay, excellent. Thank you all for popping in some names. Yes, Harvey Weinstein, oh, Clarence Thomas, classic. Al Franken, Brock Turner. Okay, great, thank you. Thank you for people who popped some names in. So hold on to that. Let me just do quick disclosures. So I'm a consultant for Intuitive Surgical and the Intuitive Foundation, neither of which have anything to do with the topic of today's talk. I was a co-founder of Time's Up Healthcare, an organization affiliated with Time's Up Now, which is dedicated to creating safe, dignified, and equitable workplaces. And that is relevant to today's talk. I was never paid for any of that work, and I have resigned from that organization. So I want to talk about a number of things today, but I'm pretty simple. So there are two things I'm going to try to convey. But before we get into that, I just wanted to kind of give an overview of where we're at now. So my talk is from Cuomo to healthcare. So what's gone on with Cuomo? This is kind of how the media would have you believe these cases play out, that there was harassment that occurred, complaints were raised, an investigation was done, and then there are consequences. As many of you know, of course, complaints were brought against Governor Cuomo related to sexual harassment. There was an investigation. The state's attorney general released a report basically concluding that he more than likely had actually been harassing individuals. And then due to public pressure, he was forced to resign. This is the clean kind of story arc that the media would have you believe, that when there is harassment, if people report it, there will be an investigation and then there will be consequences for the perpetrator. I would submit to you that that's actually very rarely the way that things play out. And so before we go any further, we have a quick poll because I'd like to know whether you all think Me Too has gone too far. So just a quick poll, yes, no, unsure. You could indulge me with an answer there, I'd appreciate it. And I'll pause for just a second there. I'm looking at the additional names. Oh, Kaczynski, yes, that was a big one. All right, just give you another 1 or 2 seconds here. I think we can, I don't know how many votes we have, but okay, excellent. Okay, perfect. Thank you all so much. So, you know, 19% not sure, 15% say Me Too has gone too far, and 67% say no. So we're at, you know, 35-ish% saying either yes, it's gone too far, or gosh, I'm not really sure. Okay, cool. That's very helpful. I'm going to make these 2 points. So one that I really hope that people can take away from this talk. One is that sexual harassment is about power. It's not about sex. And I'm going to talk about that on this slide. And then two, that Me Too really has gone nowhere near far enough. So I'll see if I can convince those of you out there who said it's gone too far. We'll see. So before we get into all of that, I want to get us on the same page with some definitions. So the basic, and this is just a thing that I created, which is a visual that helps me understand it. So the basic foundation of sexual harassment is that power differential. When there is no power differential, it is very difficult for people to transgress in the ways that, for example, Governor Cuomo was alleged to have done. Because if he and the people he was working with were at the same level, then obviously they could just call him out on it. But the reason that behavior was able to persist is because he was doing this to executive assistants. He was doing this to people who worked as his aides. He was doing this to security detail, et cetera. And so there's a power differential. Once you have that power differential, then we can have what's called gender-based harassment. And so these are verbal and nonverbal cues that basically signal objectification or hostile attitudes toward people of a particular gender. I'm going to give examples of these on the next slide. And then the next level up, and by the way, these are intentionally narrowing because they're representative of the frequency at which these things occur. So gender-based harassment occurs very frequently. And then unwanted sexual attention, which, as you can imagine, is people giving you compliments on your appearance when you're not in a setting where you're trying to be sexualized. Or people making inappropriate comments about different aspects of your body and so on. So that's unwanted sexual attention, or asking somebody out when they do not want to, in a workplace setting and they're not wanting to be going out with you. Those are unwanted sexual attention. And then coercion, which is great. I'm grateful that it's the least common, but it's the most severe type of transgression, which is either saying that you will receive certain benefits or you will receive access to a certain position in exchange for sexual favors, or that your employment may be contingent on sexual favors. So that's the kind of quid pro quo, people will call that. And really the big message of this slide is that gender-based harassment, unwanted sexual attention, and coercion are all considered sexual harassment in the framework set out by the National Academies of Science, Engineering, and Medicine. And I say that because much of the time, especially I feel like in medicine, because there is so much gender-based harassment that goes on, when we think sexual harassment, I think a lot of us think about unwanted sexual attention and coercion. And really, it's a lot more than that. So let's talk about some examples for these things. So many of you have seen this iceberg that came out with the National Academies report on sexual harassment, which came out in 2018. And kind of the take-home message of this is that all of the gender-based harassment, that's that bottom rung just above power differential on the pyramid, all of that is kind of under the water. It's the things that happen all the time that we may not really be noticing or acting on. So they're sexual teasing, sexist insults, offensive remarks about bodies, obscene gestures, sabotage of women's equipment, unwanted sexual discussions, For example, that one I feel like happens quite often in medicine. But all of those things are kind of below the level of consciousness for a lot of people. And then above the water, we have the unwanted sexual attention like assault, groping, certainly rape. And then we have the promising professional rewards in return for sexual favors, the quid pro quo or coercion aspect. And I share this because one, I think it's a really helpful illustration. And two, here are all the things that I've experienced personally. And I think this is not uncommon for women in medicine because sexual harassment is rife in our workplaces. And I wanted to highlight just a couple more things before I go on from here. One is sexual harassment can occur to people of any gender, including men, people who are non-binary, gender fluid, gender queer, etc. Most of the data that exists right now looks at men, women as a binary. And so a lot of what I've talked about so far and will continue to talk about is probably going to be about women because women are more likely to be harassed than are men. But I want to acknowledge that people of all genders can be sexually harassed. And actually, one of the things that has come up in the pandemic is, well, is there less sexual harassment now that people are in virtual workplaces, or many people are? And actually data suggests that it's actually worse than it had been prior to the pandemic. And in particular for women of color, we're experiencing more sexual harassment now than before. And then the last thing I want to address right around now is false accusations, because this comes up a lot where, especially I hear this most commonly from men, although it can be from women as well, that, and this goes to this whole Me Too has gone too far idea, that there's this idea there are rampant false accusations, and actually false accusations are quite rare. In studies, they range from 2 to 10%, depending on which population they're looking at and which type of harassment or assault is being examined. And actually for men, they're more likely to be raped in their lifetime than to be falsely accused of rape. With that, I have one quick anecdote about how this plays out for us women in medicine. So as I said, all these things in red are things I've experienced, and I want to just give a concrete example. So if you can think back to the times when we were going to conferences in person, I know it's been a minute, at least for me, it's been probably almost 2 years. But conferences are a place where these things happen frequently. So if you're a woman, so let's just take my example, I'm a woman. When I was starting out my career, I knew that going to these meetings was really important. I knew that I needed to network at these meetings. I also knew that the people who were kind of high up in these organizations were mostly men. There were a few women here and there, but I'm a surgeon. Surgery is more obviously male dominated than is medicine even. And so I had to be networking with a lot of men, many of whom happened to be older than me, many of whom had more prestige, et cetera, titles, awards, whatever. So I would go to these meetings and try to be friendly enough for them to know who I am, to remember me so they could consider me for opportunities, but not so friendly that they would think I, wanted something more from them. So at one of these meetings, there was a man who I had seen, several years in a row and at this meeting, and he said, "Oh, hey, do you want to grab drinks later?" And I thought, usually women are excluded from these opportunities, and we know that. We know that these informal networking events typically, if they're created by men, tend to include only men. So I wanted to say yes, and we did it in the hotel lobby of the hotel where the conference was, so I thought there'd be plenty of people around. So, we go, we have the drink, and then when the bill comes, he says, "Oh, well, I can't let a pretty woman pay for her own drink," which you might think is a really nice thing to say. But what it actually does is it's kind of a power play, because then it reminds me that he's not really seeing me as a surgeon or a colleague, but he's seeing me as a woman. And in fact, a pretty woman who I guess maybe he, I don't know, has some attraction toward or something. I don't know, but that's the implication. And that in and of itself, is a minor thing for sure. I didn't go home and cry about it or anything like that, but I kept that in mind. And then several months later, I was giving a talk at this person's institution. And the night before there was a dinner. And then afterward, we were walking out and he wanted to give me a hug. And, this is what I thought would be like a professional, cordial hug, a little loose around the shoulders, how we do. And this person held on long after I had let go. So I don't know if, I'm sure some of the women in the audience have had that experience where you're like this and the person is still latched on like this. It's very uncomfortable, to the point that I had to say to him, hey, I think maybe your wife is waiting for you. And that was the only thing I thought of to get me out of that really inappropriate hug. And again, did he rape me? No, thankfully not. But those are the types of relationships that we all have to navigate. Like, how do I indicate to this person that I'm easy to work with, that I'm smart, that I'm capable, that I should be part of this committee, or that I should have this opportunity, without him thinking that that means I want something more than a professional relationship. So here's how it plays out in other people's lives and in the kind of bigger sphere of what's happening in academic medicine, and also to this question, returning to my initial question of, has Me Too gone too far? So this was a case that many of you may have seen that came out, this piece came out in May in the Cancer Letter. It's about this oncologist, Dr. Axel Grothy, at the Mayo Clinic. And basically, what had allegedly occurred was that this gentleman was harassing people for years at Mayo, and eventually they did an internal investigation, found that he had indeed harassed people, and was asked to leave. Well, he got a promotion as a division chief at the Mayo Clinic in Scottsdale. Prior to him taking on that position, though, due to some activism from the folks at Mayo Clinic Rochester, they rescinded that offer. But don't worry about Dr. Grothy, because then he was able to get a position at a research center affiliated with the University of Tennessee, where he remains today. Had it not been for some really dogged reporting from the Cancer Letter, I don't think anybody would even know about this case. But the Cancer Letter went through tons of documentation and put together this piece, which, if you haven't read it, it's a great illustration of how these things play out. And what I put up on the screen here are two snippets from women who had been harassed by him at the Mayo Clinic, writing to the National Cancer Institute and the NIH, respectively, about the positions that Dr. Grothy held at those institutions, even after he had left Mayo. And by the way, he was able to get licensed in Arizona and get licensed in Tennessee, no problem, which illustrates what happens with men who, and again, it's mostly men, although it could be women or people of other genders as well, that when they harass people, they often get a promotion or a step up, and they get help to go find another position. And in the meantime, the people they've harassed, who are often women, are left to deal with really devastating consequences. You can see from the second comment here, this person says, during the years in which the harassment occurred, I was too embarrassed, ashamed, and frightened to come forward to my employer. I feared more consequences that would further limit my career possibilities, since this person is a very influential figure in the field of GI oncology. And indeed, the other person who had been writing to NCI, where he was a co-chair of a committee, says that he continues to slander his victims in the scientific community, including attempting to undermine their career advancement. So there really is this asymmetry between what happens to the perpetrators and what happens to those who have been harassed, in that the perpetrators most often get to move on to somewhere else, often more prestigious or in a more powerful role, whereas those who were harassed end up sometimes leaving the institution, sometimes leaving the field, always dealing with really devastating emotional and physical consequences. There were a couple of other high-profile cases that have been highlighted in Science in the last couple of months. Again, questioning that make me question, has Me Too gone too far, or has it gone far enough? So the one here that broke a couple of weeks ago is this biologist, David Sabatini, who was one of the people who first started understanding the mTOR pathway in mammals. And he was fired by the HMI and lost his position as the head of the Whitehead Institute. Just so people know, that came about because of a climate survey that was done including the employees at the Whitehead Institute, it was not because people who had been harassed brought forth concerns or that they reported him. The concerns came up in a climate survey, which was then, and then that led to an investigation, which led to findings that led to this. But as of today, anyway, to my knowledge, he still retains his appointment at MIT. And then Francisco Ayala over on the right is a biologist who was at University of California in Irvine. People reported him as early as 2015, which means we know that harassment went on far beyond that because it takes a long time for people to report. So they reported him in 2015. In 2018, basically at the end of his career, he resigned from UC Irvine. And it wasn't until just this summer, 2021, that the National Academy of Sciences revoked his membership. So again, back to this idea that the media timeline, that there's harassment that occurred, there's a tidy investigation, and then the person faces consequences. It really doesn't play out that way. And as one of the women at UC Irvine said, it was maybe some semblance of justice, but too little, too late, and far too much harm had been done to the survivors. So these are the reasons that I wrote a couple of pieces on this topic. One for Scientific American, saying that sexual harassment is still the norm in healthcare. And then one for the Cancer Letter, talking about this phenomenon of what we call passing the trash, that when people behave unprofessionally and inappropriately at one institution, we as a culture in medicine help them move right along somewhere else. It's really more looked at as, well, this didn't quite work out here, let's help you make it work somewhere else, as opposed to, you know, maybe they need remediation, maybe they need some sort of support, maybe they need to not be in those settings, and maybe in some cases they need to lose their title and their career. I'm not saying every case needs that, but I think that certainly doing nothing and just passing them along to somewhere else is not helpful for anybody. And it sets up people at the new institution for more harassment, often not having any clue that this had all been happening before, even though certainly people did know, they just didn't share that information. So why does this happen? These are kind of the four main factors that seem to be at play, and these come directly from the National Academies report, looking at what kind of environments foster sexual harassment. And you might recognize that we have a lot of these in medicine. So one, it's an environment that is male dominated. Check, we've got that. Two, it's an environment that has a steep hierarchy, or at least a very rigid one, and check, we've got that. Three, it's an environment where there is tolerance, where people see sexual harassment happening and for the most part do nothing. I would argue that we've got that too. And the last one is when people are isolated. So if you think about, let's say, a graduate student who's working in a lab and working alone, you know, at night, or working one-on-one with their advisor, or if you think about an intern on call, you know, in medicine, you all have more people in-house often than we did in surgery, but we often would have people who are one-on-one, you know, second-year resident with an attending, and there's no one else around. So we have a lot of circumstances where people are isolated. So as you can see, we've got all of the factors that make an environment really like a bed of growth for sexual harassment. And you might think back to, you know, I said from Cuomo to healthcare. So, okay, Cuomo, he's a politician, politicians are gross. What does that have to do with us? Well, I pulled out a couple of things from the Attorney General's report because they resonated for me in my experience of medicine. So I wondered if it might kind of bring that home for you all, that it's not just people like Cuomo who are harassing people, it's people who are, you know, our colleagues in one way, whether they're people we know through our professional societies or otherwise. So the first red box here is from Charlotte Bennett, who had worked with Cuomo, and says, if you got yelled at in front of everyone, it wasn't any special day. It was controlled largely by his temper, and he was surrounded by people who enabled his behavior. As a result, when the governor said inappropriate things, Ms. Bennett said, I was uncomfortable, but I also was acutely aware that I did not want him to get mad. Like the consequences of him getting mad for her speaking up were going to be worse than if she just put up with what he was saying in the first place. And then this second red box here tells you a lot about the office. So they say, this is Ms. Liss, who was also one of the 11 people who brought complaints against Cuomo. For whatever reason, in his office, the rules were different. It was just, you should view it as a compliment if the governor finds you aesthetically pleasing enough, if he finds you interesting enough to ask questions like that. And so even though it was strange, uncomfortable, and technically not permissible in a typical workplace environment, I was in this mindset that it was the twilight zone and the typical rules did not apply. And that last piece, that it was the twilight zone and the typical rules did not apply, I experienced that so many times in my training and as a faculty member, that the things that you would never see happening in a grocery store or in your outside world were happening in our hospitals, and it was just normal. So going on, they talk about the way the staff handled the situation. So in Ms. Bennett's case, she was moved to another office, but there was no other investigation that was done. And actually, the senior staff sought to implement a practice whereby individual staff members who were women were not to be left alone with the governor. And I just want to point that out, because if you get to the point where you're making that kind of policy, you need to be rethinking what's happening in your office, and there needs to be a different intervention that takes place. I recognize it's very difficult in an office like that with the governor, but this is the same type of thing that I see happening in our medical institutions, that we have people who are extremely problematic, and instead of dealing with their problems, we come up with workarounds like this. Okay, well, this person harasses men, but let's just make sure he's never alone with the woman trainee. That's not the solution. So in conclusion, in the summary of the AG's report, they say such behavior by the governor was part of a pattern that extended to his interactions with women outside of state government and was enabled and facilitated by a culture within the executive chamber of secrecy, loyalty to the governor, and fear, as well as the normalization of inappropriate comments and interaction by the governor. And again, this is what I've seen over and over again, the normalization of inappropriate comments and people who will stay silent out of loyalty and fear. And until we address those cultural issues, we will continue to have sexual harassment, which has devastating consequences for survivors. So let's talk about that for a minute. I showed you the media timeline, right? There's harassment, there's an investigation, there are consequences, very tidy. In reality, what happens for survivors is not tidy in any sort of way. So this is not, by the way, there's no one way that it happens, but this is an example of what might happen. So you have the initial harassment, and then you see a descent as the person who's being harassed experiences confusion, depression, PTSD, all sorts of mental and emotional distress, especially because by and large, these offenses occur with someone you know, someone you have a relationship with. And it is extremely destabilizing when they start to treat you in ways that you know are inappropriate, and yet you don't know what you can do, if anything, to stop it. And so let's say this person decides to report. As you see, that's where the ball shows up there in the diagram, because then things get really, really hard. And this is why most people don't report. In fact, in case people don't know, the vast majority of cases of sexual harassment and assault are not reported. So once you report, then you're vulnerable to DARVO. So this is out of Jennifer Freyd's work. Deny, attack, and then reverse victim and offender. And once you know DARVO, you will see it everywhere. So the person who is the perpetrator says, no, 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 that never happened. And in fact, actually, so they attack the person. This person was wearing this or doing that or said this, and that's what made me act in this way. And they then, the perpetrators, act as though they are the victim. And really the person who was harassed is now portrayed as the offender. And that happens all the time. It happened with Cuomo as well. When Lindsay Boylan, who was the first person who came forward, had put her concerns out in the public sphere, Cuomo's team had drafted a letter that was a sort of op-ed, which many of us have not seen, but reportedly one of the main functions of that op-ed was to discredit Lindsay and to blame her. So this is a very common playbook, which obviously is devastating to people who are experiencing that. Then again, once you've reported, if you're going to pursue a case, you've got legal fees, and many people are not in a position to pay those fees. Then you have needs for mental health care and therapy, which again, you may or may not have coverage for, which is also costly. And for many people, it results in a change either in the location that they're practicing or a change in their career altogether. So you can start to see why people may not want to report. There's also the relationship strain. So when you do report any, let's say you have a partner, all of the strain that this individual goes through, the person who's reported, is passed on to those who are close to them. And that causes new problems within that relationship. And all of that for maybe a settlement. You know, in many cases, eventually the person who brought the complaint actually withdraws it because of all of these things that happen, and it's just not worth it. Their whole life is turned upside down. They're often discredited. It's very hard to move on to the next step. And I put the question mark there because hopefully we know that people can recover. And we hope that that's going to happen. But for some people, there is irreversible damage that's done by this process. And this was all documented as well in the National Academies report in terms of the consequences of harassment. There are job-related variables like job satisfaction, organizational withdrawal, decreased productivity, worse performance, and also significant mental and physical health consequences, which they conclude leads to a significant and costly loss of talent in science, engineering, and medicine. So, you know, when there was this latest wave of the Me Too movement back in 2017, that was when, you know, Harvey Weinstein was first arrested and so on. Time's Up was thought to be the solution. So Time's Up, as I said at the beginning, is an organization dedicated to creating safe and equitable workplaces. And some of you may remember this speech by Oprah at the Golden Globes in 2018. You know, many of the actresses showed up that night wearing all Black. They had brought with them activists in the sexual assault space. And Oprah gave this very moving speech. And she said, for too long, women have not been heard or believed if they dared to speak the truth to the power of those men. But their time is up, she said. Their time is up. And even now I feel the power of those words, but unfortunately their time is not yet up. And we can talk more about Time's Up in the discussion if people have questions, but in the wake of Cuomo's resignation, shortly thereafter, Roberta Kaplan, who was the chair of the board for Time's Up, resigned, as did Tina Chen, who was the CEO and president of Time's Up, because of revelations around their involvement with Cuomo and other things. So unfortunately, this movement, the Time's Up movement that many of us had thought were going to help indeed create those workplaces, has not yet been able to do that. So what are things we can do? Well, almost everywhere along that timeline that I showed you, the survivor timeline, are points that we can intervene on. So we can prevent that harassment from happening in the first place by not passing the trash along, by not hiring people who we know have harassed people at their previous institution, or by making sure that we give them adequate training, not an online module, and that there's true accountability for people who are harassing. We can make it easier for people to report. It is so hard to go through that whole spiral that I described to you earlier. It is often hard to have the courage to report in the first place. It's hard to know who to report to, and then the way that reporting is managed in most institutions, and particularly in higher ed institutions where it goes through Title IX, the person who reported loses complete control over everything. But once they report, there will be an investigation that they have no control over, their anonymity is gone, and they've already been violated. So that whole process really could be redesigned and should be redesigned with survivors in mind. We can intervene at DARVO when we see it happening, when we see people attacking the victim. That is where we can intervene and say, that is not okay. It is not that person's fault that they were harassed or assaulted. Institutions could, I know this is a little radical, but institutions could cover legal fees. If we really wanted, and I mean, we generally, not necessarily any particular department or institution, but if we really wanted people to report, if we really wanted to get rid of sexual harassment, then we would address all of these barriers, and covering legal fees is a barrier. Covering mental health fees is a barrier. Helping people maintain their career and or grow their career because they have showed dedication and commitment to the institution by reporting, that would be another thing. And I'll just say that last point again, because some people don't realize this or aren't aware that the people who report, like whistleblowers, those are usually the people who actually believe in the institution. They believe the institution can do better. The people who don't believe in the institution are the ones who just leave. And so what we do currently, and we, again, the general we, is we take that trust and faith and we ruin it because they enter this cycle and everything spirals out of control. Now, it does not have to be like this. And at the point of settlements and law cases, we as institutions could be taking a survivor-centered approach, and we really are not, because we're trying to protect the organization. And I don't think that you can, in the current system, protect the organization and protect the survivor as well. So these are all points of potential intervention. And so back to the original question, has Me Too gone too far? You know, I said it to you at the beginning, and I'll say it again. No, it has not yet gone far enough. Nowhere close, if you ask me. So I'll just leave you with this quote here, and we'll go into the question and answer session. Vulnerable, sick people deserve to be cared for by experts who can work at the top of their game, unfettered by workplace harassment and discrimination. And that is not the workplace we have yet. But we can create it. And I hope that you'll join me in trying to create that world.